All right, so my name is Carly Stratton, and this is my benchmark for the evidence-based practice proposal presentation. It's going to cover the lack of medical and dental integration. So imagine you have a car and you take that car and you look at it and all the check engine lights are lit up on the dashboard. And then you take that car into the dealership where they look it over, they write up a diagnosis, and then they try to help you understand the best course of action. 2 months down the road, your dashboard lights back up again and you're kind of at a loss. So you just out of nowhere you decide, let's take it into a lube shop. And then they tell you, well, all you really needed was an oil change and some regular maintenance, and all these issues never would have happened again. Wouldn't you be pretty frustrated if that happened? But now, instead of your car, imagine that's you, and you're suffering from a chronic inflammatory disease that doesn't seem to get any better. When you want your healthcare provider to be able to point you in the right direction, this lack of integration between the medical and dental field is the topic for this presentation, and we'll explore the reasoning for integration between the medical and dental fields, and prove why integration is required for disease management. Okay, so the problem or issue to be discussed is there is a disconnect between oral health and primary health care. This is a problem because inflammatory conditions are going undiagnosed and untreated, and patients are not receiving the best care possible. It is estimated that each year 108 million Americans see a physician who do not see a dentist, and on the other side of that, an estimated 27 million people each year have a dental visit with no medical visits. So this disconnect leaves for certain conditions and diseases to go undiagnosed and untreated in both fields on both sides of the spectrum. What affects oral health will in turn affect the general well-being of an individual. Oral health is determined by diet, hygiene, smoking, alcohol use, stress, and trauma. And when you think about it, these factors also play a huge role in the overall health of a person, not just their oral health. Therefore, to increase a patient's outcomes, we need to adopt a collaborative approach. It's going to be more streamlined than one that is disease specific. So then we're going to look at the PICO question for this specific problem. This PICO question is going to be, how can healthcare professionals help illuminate the oral-systemic relationship by working together instead of separately to improve overall patient outcomes? I really like this PICO question because it addresses both the medical and dental teams equally, putting the responsibility of integration in both courts. Alrighty, so let's look at some data from the literature review portion of the project to help generate a scientific rationale for integration. So this was taken from all of the different sources required for the project. The first little snippet is going to be the prevalence of oral systemic relationship has accounted for potentially preventable chronic conditions and morbidity worldwide. Analysis showed that globally patients with major systemic conditions have poor knowledge and awareness, less than 50% of the oral health associations to their conditions. And conditions such as diabetes have been shown to increase the risk of periodontal disease. Conversely, periodontal therapy may improve the diabetic condition by stabilizing the systemic blood sugar levels. Continue on with some data collected here. There have been a very large number of studies conducted to test the validity of the relationships, for example, between periodontal destruction and the prevalence of myocardial infarctions and strokes. There is an enormous need for the healthcare professions to develop and implement a system integrating medicine and dentistry. And most dentists, 97%, believe that more patients would seek oral care if they were aware of the oral systemic link. All in all, there is sufficient enough evidence to support a rationale for integration and prove that by doing so, patient care and outcomes will be better for it. Alrighty, so looking at the theory and the model, naturally, as we learn more and more about why integration is so important, we begin to ask ourselves the big question, so how do we do it? Well, the answer is in 2020, the CDC released a framework for the national integration of medical and dental. This framework will outline opportunities to integrate medical and dental services in different healthcare and public health settings. to support populations with unmet oral health needs and associated chronic diseases. This plan included 6 steps that were implemented at the State Department level, but these steps can also be applied on a much smaller scale as well. Following the CDC's plan, it can be applied in private practices and corporate dental facilities to stimulate change and need for success. The 6 steps are to assemble an advisory panel of chronic disease and oral health personnel to oversee the project, create a project work plan that uses oral health program activities to impact chronic disease, use an oral health program staff, partners, and activities to implement the project work plan, assess the project through process and outcomes and evaluation measures, build communication among state program staff to strengthen collaboration between the programs, and to report project outcomes to state and national chronic disease and oral health partners. The proposed solution. Once the state's health department is on board with the integration plan and it is in full swing, professionals across the state will start to take notice of this trend and will begin to investigate the program. Dental and medical professionals all have a legal and moral responsibility to stay updated on upcoming trends in their fields, and by doing so, they will hear about the changes being made at their state levels. From there, the state health department will be able to take the information gathered from the program and use it in previous data to share with the professionals in both fields. This education is vital to the next phase, which would be to implement the process on a smaller scale in the offices so that data can be recorded and shared with other industries and states. The solution will help streamline the integration process and will overall lead to success, as seen in previous 6 states who have already adopted this plan. So the solution kind of flow here is going to be to implement the 6-step plan, train the professionals, implement the plan at the private practice level, and then record that data. Alrighty, so the implementation plan. For the sake of this presentation, we're going to focus on the private practice implementation plan, as the state health department will have already implemented the CDC 6-step plan, and they have a very specific way of doing that. Most of us will not be involved at that level anyway, so it's more beneficial to focus on what will be happening in our daily lives. So to implement this plan here, we need to train our staff, establish a referral network, screen our patients, both in the medical and in the dental fields for, inflammatory diseases on both sides, and then educate our patients about it. The evaluation plan. So both qualitative and quantitative data is recommended to be gathered, as both are necessary to ensure that true success was achieved. To start, in-depth interviews can be acquired to better understand project implementation, facilitators, barriers, and lessons learned. So to collect the necessary quantitative data, regular goals should be preemptively outlined to measure their overall success in the program. For performance measures, the 6 states had developed a numeric indicator value and identified whether they had met that target, were in progress to meet that target, or if the work was ongoing and had not met that target. The CDC measured this data in areas such as awareness, communication, and incorporation of the dental and medical fields as one, and these targets can be measured at both the state and private practice levels as well. All right, the dissemination plan. So in order to properly disseminate the results of the program, the first step is collecting the data and organizing it from the evaluation portion of the project. This qualitative and quantitative data is essential to this phase of the program, as we need the evidence to actually disseminate it. This evidence then needs to be reported to the appropriate offices or entities. So at the State Department level, the evidence needs to be reported back to the CDC, as it's their plan and they have their own process for this phase. And at the private practice level, reporting should be done to the sponsor or manager of the program, as they will oversee the publishing of the data. Publishing of the data can be done on so many formats, including professional organizations, conferences, journals, or the employers. The potential is endless, and this way the information can be easily spread throughout both communities. This creates a network of professionals looking to better patient outcomes and opens up a conversation that should have been opened up a long time ago. Alrighty, so in conclusion, the best way to deepen knowledge and expand skills in the healthcare field is to participate in ongoing evidence-based research. By doing so, the professional can take the expertise that they already have and refine it in a hands-on opportunity that advances their field and generates better patient outcomes. When a professional can see the results of the research, either working or not working, up close, they gain a better understanding of the topic and can develop their own thoughts and feelings on the research. With these newly found feelings, creative and inquisitive thoughts can then be started and thus applied to the issues and others like it. Each mind takes information in a different way, and this diversity of thinking is what advances our fields and creates a better world around us.